Any of you out there remember the moment when you realized that nursing wasn't what you thought it was? How long? Drop me a comment and let me know how long it took you after you graduated from nursing school and started working, or maybe it happened in nursing school. But anyway, my name is Natalie. Welcome to the Nursing Hustle, and today I want to talk to you about this. I saw this post about a nurse that's leaving Med Surg after only 4 months, and it really hit home. And I had to think back about when I was working on the floor and how long it took me to realize that I didn't want to do this forever. Honestly, if you've seen my other video, you know that by the time while I was in nursing school, I had already discussed with another nurse that there were other options for nurses besides hospital nursing. And so I already knew that going in. But the reality doesn't hit you until you start working the floor. So let's read this, and then drop me, as I'm reading through what this post from a fellow nurse, drop me a comment down below. Let me know what your thoughts are. So she says, I'm a new grad nurse on a Med Surg unit day shift with 1 to 6 patients ratio with no LPNs and minimal aides. I think that's what really caught my attention. That's what really, I had a flashback. I mean, I've been a nurse for 30 years, haven't worked on a nursing unit probably in the last 15 years, but this was a flashback. Listen, I know I digress here, but some of you drop me a comment and let me know how many of you have trouble finding your nurse's aides. My nurse's aide, if I had one, was never available. I don't know where she was, what room. Wasn't in any of my patients' rooms. Anyway, I just always wondered. And then they would show up at the end of the shift to let you know they were leaving. Their shift was done. Anywho, let's go. I'm constantly stressed out and been looking at outpatient jobs. I received an offer from an outpatient endoscopy office that the pay is $10 lower, but it seems so peaceful. And all the nurses look so happy. Plus, the manager said everyone gets their break and they even provide lunch. It's 4 10-hour shifts, Sunday to Wednesday. I feel like a failure for quitting the hospital so soon and taking the pay cut. I haven't put my 2 weeks in yet and am super nervous on how to go about that, and how my shifts will be after. I plan to type up a letter and speak to my manager about it, but would like some advice on what to say. I feel like I rarely see my manager and they're gonna be shocked since I'm still new. Everyone says to stick it out for a year, but I'm just over it. How freaking sad. So I have a few things to say about this, and you guys drop me a comment if you caught on to what this nurse was saying. First of all, there's some type of martyrism that happens when you become a nurse, right? You become a nurse and all of a sudden, you're just supposed to take a beat down on the nursing unit. You're just supposed to stick it out, whether your health is failing, your mental health is failing, you're falling asleep, they're running you from, day shift to night shift, and you don't know which end is up and which end is down. I just don't get it. And something that really caught my attention here was at the end, was that close to the end, when she says she was looking for advice because she didn't know when she put in her 2-week notice what her shifts were going to be like. You know what that says to me? Do you know what that says to me? That says to me that it's abuse. Why should her shift be any different? Why should her schedule be any different from previously just because she puts in her 2-week notice? It's because obviously she feels that there's a sense of abuse going on in the situation. And that is it's so common. It's so common, right? It's like, it's what they do it's what happens with per diem nurses, right? When the per diem nurse comes on, you get the shittiest assignment. And of course, the thought is that you're getting paid the most, so why not you get the shitty assignment, right? And in a sense, I get it, but it's so abusive. Instead of just taking the extra help and evening out the assignment and making it more comfortable for everyone, no, you're gonna choose to abuse the person that's coming in to help you until they can't take no more. And then you're back to the same shit again. Like, drop me a comment down below, nurses, my fellow nurses, and let me know what your thoughts are on that. And then the other sad part that I noticed was that when she said she was going to endoscopy. Let me know if any of you out there are working in endoscopy. I've never worked endoscopy, but I've heard it's a little bit nicer than working on the floor. So let me know. But the pay is $10 lower. But for her peace of mind, it might be worth it, right? $10 lower, $10 less an hour. And that's huge. That's a huge pay cut, right? But how to be even thinking about taking a $10 pay cut, how bad is it? How bad is it? Like, it has to be pretty bad, right? Like right now, for me to take a $10 pay cut, $10 an hour pay cut, shit would have to be hitting the fan. So let's see what responses she got. Somebody said, do what's best for you. Leave the hospital properly. So if you want to ever go back, you can. Maybe if enough people leave with the same complaints, they'll get more help. Has that worked in the past? I just had to laugh. I was like, do you know how much of a turnover I've seen working in the hospital? It's insane. And it doesn't get better. And if it does, it's only a temporary, for a fraction, or what's the word I'm looking for? It's only for a small amount of time, and then it's back to the same thing again. You know, it's like if you have a sentinel event on your floor, all of a sudden everyone's coming in and they got to make things look pretty because they're getting investigated, right? But as soon as investigation's over, it's back to the same bullshit. So don't get me started. Okay, so someone else says, yeah, I don't plan on doing that. Just speaking to her to let her know I'm putting in my 2 weeks notice. It's going to be an awkward and go back. Someone says I wouldn't bother talking to the manager about the work culture. That's a waste of time. 410s would be a dream for me. So yeah, and then that's when she responded and said, yeah, I don't plan on doing that at all. Just speaking to her to let her know I'm putting in my 2 weeks. Someone says, I second this. Wouldn't even bother bringing up concerns. I worked on an ortho unit and only lasted 5 months. I wanted to prove myself that I could handle surgery, even though all my friends suggested not to do it, specifically on this unit. Now this, do you know when you leave something, like you finally get out of something and then you forget how bad it was? This particular conversation about ortho brought back some crazy memories, some stressful memories for me, because I worked ortho. I worked at a hospital. I staffed a hospital where I worked the ortho unit, and we had I would have like 6 patients, and that's a lot for an ortho unit. When your patients are post-op, you're getting post-op admissions, you have discharge, and your patients, it's ortho. Listen, your patients are in pain. So they require constant pain monitoring and medications. And heaven forbid heaven forbid, you get caught up in an admission, or you get caught up with one patient that really needs your attention, all your nursing bells are going off. You nurses out there, tell me, drop me a comment, drop me a bell emoji if you know what I'm talking about. Because it's crazy. It's crazy. It's enough to make you batty. All the nursing bells going off. Your patients are screaming in pain. They're asking for pain medication. The doctors it just brought back so many freaking memories. The doctors finally showing up at the nursing station, or maybe you put out a call to the doctor because you needed an increased dose for your patient, and then they call back when you're getting up when you have your ortho patient up and you're getting them up to ambulate for the first time, right? And then that doctor's pissed that you're not available when they finally call you back. I don't know. So many things are absolutely insane. And because with ortho, there's a lot of, depending on your patient, condition prior, if they have other things, like if they're diabetic, there's so many things, and there's so many things that can happen post-op, especially fresh post-op. You're looking for compartment syndrome. Who knows what I'm talking about? Oh my gosh. And if your patient has compartment syndrome, yeah, you're in for a hell of a shift. Okay. So they told her not to do it. I got to go back. I digress. But if you guys know what I'm talking about, please let me know. Drop me a comment. The entire unit was team nursing, and it was absolute chaos. There was no good shift. Every day we were short. The healthcare aides would hide. What did I say? Oh my gosh. Do you remember? I couldn't find the nurses' aides. I swear they were hiding. I don't know where they went, but they were just unavailable. And a lot of times you needed your ortho patients. This just came to mind. Oh my gosh. Ortho patients sliding down the bed. Now you got to pull them up, and you can't pull them up by yourself. So now you have to find your CNA or your HCA to come and help you pull your patient up, right? But they're nowhere to be found. Do you know how many other times I had to go pull another nurse out of the hallway and say, please, can you come help me? Because my HCA or CNA was AWOL. Now, I worked as a nurse's aide. I did before I became a nurse. I worked as a nurse's aide. So I'm not throwing shade at the nurse's aides, because I know that they're completely beat up also. Because if as nurses we have a 1-to-6 ratio, the nurse's aide gets a 1-to-12. So is it really their fault? They got to change bed sheets. They have to help with they have to help you with ambulations, pulling patients up. The patients are bedridden. They need, constantly, maybe they're wetting the bed. They got to clean the room. There's a lot of things that have to be done. And I worked in a hospital where the nurses, the CNAs were trained, and they were responsible for blood draws and doing the glucose checks. And I think maybe they still do that now. But what happens when you can't find your nurse's aide and it's time to give your insulin and the glucose check hasn't been done? Guess what? You have to do it yourself. Anyway, as I'm starting this channel and I'm going through different content, to find out what nurses are experiencing out there, it just blows my mind that it just hasn't changed. And then people are wondering why nurses are leaving the profession in droves. Why not nurses are exhausted. So let's go on. The charge nurse, she says the charge nurse was a ticking time bomb. Of course she was. Of course she was. There were a few shifts where I was working with all new grads or all casuals, which are your per diem nurses. Don't even get me started on the fact that there were shifts where I truly felt my license was on the line. Oh, hell yeah. Hell yeah. Yeah. You know, your patients are complaining. The families, like, we called you like an hour ago. Where are you? The patient still needs their pain meds. maybe you went to get if it was morphine, if they were like post-op or something and they were getting morphine or Demerol, you have to go get it out of the dispenser, and heaven forbid you can't find another nurse to co-sign for you. Absolutely insane. Okay, so don't even get me started on the fact that there were shifts where I truly felt like my license was on the line. 3 nurses per side with 10 to 12 patients. Are you freaking kidding me? It was not safe. Some shifts, I had absolutely zero idea what was going on with some patients and had no time to check up on them. They also heavily relied on updating the board. So during the shift report, sometimes we would be so scrambled while whipping up Connect Care to see what the updated lab values were on the patient. Yeah, because now you also have to pass on report, right, ladies, gentlemen? And if you're not a nurse and you're watching this and you've been a patient at a hospital, drop me a comment down. Let me know what your experience has been. I mean, 10 to 12 patients. That's not safe. And, you know, it's very common practice they say patients sleep at night. Really, your patients are sick. They're in the hospital. If anyone has worked night turn, you know that you might have some nights where it's fairly quiet. And you may have some nights where that's when everything goes wrong. That's when your patients code. That's when you have like the strangest things happen on night shift. And imagine 10 to 12 patients that you're taking care of. Someone said, just go. You're too early in your career to feel burned out, and you can always try again elsewhere when you're ready. But that's the thing, like, you're burning a nurse out in her first 4 months. How is that possible? Why, I know why. We know how it's possible, but they're not listening. It's the bottom line is they're not listening, and they're claiming that there's a nursing shortage. No, there are plenty of nurses out there that just decided to leave the profession. They're just not working as nurses anymore. Unfortunately, someone says, unfortunately, I wish the hospital listened to our complaints. I'm working at 2 hospitals now, per diem and full-time. One has union, so currently the maximum patient that the Med Surg nurses take is 5. My full-time hospital does not allow a union. Last year, there were a few shifts. I had 8 patients. Unsafe. And the charge nurse was trying to give me and my coworker a 9th patient. Everybody says, hell no. This year is a little better. Most of the time, 6 patients, no more 7 or 8. I already have a lot of coworkers quit. I have already had a lot of coworkers quit. There is one new graduate who walked out during her orientation and never came back. Another one quit after hired, not even a month. Another one quit 2 months after. Listen! And after 1 year, quit after 1 year and went to outpatient. So if you want to go, just go. Don't feel bad. Someone says, put yourself first. Take endoscopy job while you figure out your path in nursing. I just, I guess the point of me coming here today is to show you how tired, how tired we all are. This patient, the patient load, you would think, oh, 6 people, the nurse just needs to pass a few meds and then, the shift is over. No, it's not that simple. You are responsible for that patient's care for the whole shift. These patients, especially like in an ortho unit, the patients are in pain. And Med Surg, you have maybe not ortho, but you have other surgical patients on your Med Surg, and patients. If you can imagine this, I've been reading some other posts where patients are turned away in the ER because they're not bad enough, like they're not sick enough, right? So imagine by the time a patient does get to your Med Surg unit, they're really sick, and now you have 7, 8 patients that you're taking care of. It just doesn't make sense, and I'm bringing this out. I'm putting this out here because I feel like everyone needs to know. Patients should know what they're getting into when they go to the hospital so that they can advocate for themselves. The long gone is the time when a patient goes to the hospital and is, there may be a few outliers out there as far as hospitals go, maybe private hospitals, I don't know. But long gone is the time that patients go to a hospital and they are, they're getting impeccable care. So if, when patients are going in thinking, oh, I have a nurse, there's a doctor, I have this whole team. No. Yes, they're there, but they're not there. They're there, but they're not just there for you. They're there and they're overworked and understaffed. Someone else says, don't be hard on yourself. I did the exact same thing. The hospital was really worsening my mental health. I've been working in outpatient endoscopy and I've been so much happier. It helps that all the doctors and staff I work with are super supportive and it's a good atmosphere. Like I said, I have never worked endoscopy myself, but I've heard it can be a dream compared to what we experience as nurses on the floor, working the floor at the hospital. So you ladies and gentlemen, you nurses out there, drop me a comment down below. Let me know how you've dealt, if you've had similar situations, how you've dealt with it, where you are in your nursing career, if you're thinking of leaving, if you have left already, if you are, if you're looking and you don't know where to start, because I'm going to be sharing some of my experiences, and I'm going to probably create a private Discord group of some sort where we can talk and I can share my experiences and maybe help you get started on a different path to get away from floor nursing. But you know what the sad part is? As I jump on here because I know many of you are ready to make that move, but just as I was. But what's really sad is that, I honestly, at one point I thought, oh, maybe I'll go back. And when I get online and I go through different threads and I read something like this, I don't want to go back. I'm getting older. I've been 30 years in nursing. And there's nothing about what's happening today in these hospitals that makes me want to go back. Do I miss the patient care? I sure do. I love patient care. But when you start to realize that you're putting yourself at risk, like you're putting your license at risk, right? You just spent money to get a nursing license, to earn a nursing license. And then once you have it now, these environments are doing everything to take it away or maybe even land you in jail. I have another video because there's someone here that talks, we're going to talk about med errors next, and how this impacts not just the patient, but how the nurse who makes the error is so impacted. Her whole career is impacted. And I would say that most of the time, it's in those first couple of years of nursing that you're gonna find that you're because you're still learning, right? That you are prone to making the most mistakes. But they're taking new grad nurses, and they're throwing them to the wolves on the nursing floors with 8 patients. It's impossible. If a seasoned nurse doesn't have the skills yet, if the seasoned nurse, not that she doesn't have the skills, but if the seasoned nurse is stressed out taking care of a patient, of 8 patients, after 10, 15 years of nursing, how do you think the seasoned nurse, how do you think the new grad is doing? It's impossible. Just because they're done with nursing school, they don't have all the skills that they need yet. They're still learning. They're still gaining skills. Yes, in nursing school you have clinicals, but you don't, those clinicals are for a day here and there. It's not until you graduate and you are working in the hospital that you get those back-to-back days and you get that consistent experience that you need to hone in on your nursing skills, your assessment skills. And no amount of skills that a nurse earns makes her competent to take care of 8 ortho patients post-op. Are you kidding? Anyway, that's my rant for today. Thank you for joining me on the Nursing Hustle. Drop me a comment down below. Let me know what your thoughts are. Let me know what your experiences are, what you'd like to see more of on this channel, what you're looking to do. If you're looking to leave nursing, if you are still nursing, how that's going for you, what your experiences are. And until next time, work and hustle smarter, not harder. And let's do it together.